Hi, I'm Ryan Hunter, and this is Kalispell Connections, a program where we talk about issues important to the community. And with me today is Dr. Kevin Keeton from the Kalispell Regional Hospital. Welcome, Dr. Keeton.
Thank you very much for having me.
So I wanted to have you on and chat about the COVID-19 situation in Flathead County. I know you've worked a lot with the COVID patients up at the hospital. Could you talk first about that experience working with those patients up there?
Yeah, luckily in Montana, when it first started, we didn't have a lot of cases. Montana being as isolated as it is, we started out pretty slow, but over the last several months, we've really kicked up the number of hospitalized patients. The same that goes with the increased number, just overall infections in all of Montana. You know, we had averaged, maybe 3 to 6 patients at a time. Now we're averaging between 25 and 35 patients at a time in the hospital, and that's a huge number comparatively to anything. I mean, I don't recall a time where I've had infections with a single thing leading to 25 to 35 hospitalizations at a time. It's one where when it first started, we made the decision to make our own COVID unit, which is a area in the hospital that's cordoned off from the rest of the hospital. It has different airflow and good venting and everything else to try to keep the COVID patients from infecting people in the hospital and try to make staff as safe as possible. And pretty glad we did that. Of course, we've kind of met our capacity for that, and we've had to expand it out just because of numbers. But I can tell people that this is definitely a real disease that causes real problems. If you're lucky enough to have mild symptoms or no symptoms, good for you. But there are a large number of people who have major issues with this, and it's having short and long-term effects on people's ability to breathe and recover from the disease.
Yeah, those long-term effects too are largely unknown exactly how long they'll last, and I mean, it seems it's such a new virus that we don't know everything about the impacts it will have, even with
Right.
those folks who survive it and recover. And
right. And there's a known subset of people called long haulers who just are debilitated by chronic fatigue from this. And they're doing trials to see if there's anything that can help these people, but there's still not anything approved to try to help them with their fatigue and shortness of breath that they have weeks to months after the illness. I mean, even the people in the hospital, there are some people who have a day or two of symptoms and they do fine. They don't get hospitalized. And then the majority of people, once they get sick enough to be in the hospital, they have at least 1 to 2 weeks of symptoms, and that's if they recover. Some don't even recover. They just hit kind of a plateau phase where they're not getting any worse, but they're definitely not getting any better. And we think that's secondary to underlying lung fibrosis or scarring. You can have the acute inflammatory process, which makes you acutely ill, but if you develop scarring and fibrosis, then there's nothing to fix that. Once the lungs are scarred, they don't unscar themselves. So you can be left with a severely debilitated lung process, which requires a huge amount of oxygen. And the problem with oxygen is we can only supply so much at home. There's only so much you can provide through portable tanks at home. So people are getting stuck where they can't leave the hospital because they can't get they can't get down to the amount of oxygen they would need to get out of the hospital. And that's just laying in bed. When you get up and start moving around, your oxygen requirements go up significantly. So people, even if they can get home with oxygen, they still may have a lot of difficulty getting around just because their oxygen gets so low when they start moving around. So it's definitely a serious illness. We don't have a cure for it, of course. Everybody's looking for the magic bullet. I would love for it to be a magic bullet out there. There's just not one. We have things we think that help. We're doing everything that the major centers are doing as far as antivirals, steroids, even anti-rheumatologic drugs and convalescent plasma, which has antibodies in it. We're doing all this if it's needed, but there's nothing that says that just because you get all of those that you're going to do okay. There's still the subset of patients who get all of that and still die from COVID. So
Yeah, it seems a lot of people focus on that death number, which of course is really high. Nearly 250,000 people across the country, which, there's not a lot of things that cause that kind of deaths in our country. But it's looking beyond that. It's these effects. Even if you don't die from it, you can have serious long-term effects, even if you survive it.
Right. The last 5 flu seasons didn't kill anywhere near. I mean, combined, the last 5 combined didn't kill this many people. And then we're going to have, for years to come, post-COVID patients who we're going to have to follow in pulmonary clinic or because they have chronic long-term effects from the pulmonary damage that COVID caused.
And I know, these numbers at the hospital is causing a bit of strain at the hospital, is it not, in terms of staff? I think some staff are coming down with it, having quarantine and, having enough nurses and that sort of thing. Can you speak to the strain it's putting on the hospital?
Yeah, we knew, and this is hospitals around the country, Montana, everywhere, have had trouble with this because you want to be safe. So anybody with significant exposures, whether it's at the hospital or at home, you try to quarantine. Anybody with typical COVID symptoms or even mild cold symptoms, such as cough, loss of taste or smell is a big one when it comes to COVID, fevers, even, runny nose and scratchy throat typically will get you checked to see if you need to still be there. Because the last thing we want to do is give patients who don't have COVID just because somebody who works up there is working around them. Of course, at the hospital, we all wear masks. We do our best to not put anybody at risk. But this disease takes a little bit longer than most to show itself. So the quarantine is between 10 and 14 days. So if you get quarantined, whether it's because your kid got it and brought it home to you and you had to be quarantined for 2 weeks, or you had an exposure at a community event or somewhere like that, and it's a good exposure greater than 15 minutes in a closed space with no mask, then you're going to have to quarantine. And our valley only has so many nurses and so many respiratory therapists and so many pulmonologists and critical care docs and hospitalists. You start taking them out and having to quarantine them, and it puts a big strain, not counting just the bed situation of when patients get put in the hospital. The majority of them are there for at least 5 days, and some are there for 3-4 weeks. I mean, if you're looking at any other disease, most diseases, even pneumonia and sepsis, we're able to turn them around and probably get them close to out of the door in 4 or 5 days. I mean, we're lucky if we get COVID patients out in 5 days. So it takes a bed. They stay there for a while. You have to wear more protective equipment around them. So gowns, mask, all these things you've got to do every time you go in the room with them. And there's a limited supply nationwide because every hospital is dealing with this. And so you put a big strain on the system, the more COVID patients you have. There's a lot of hospitals in Montana on what we call diversion, which means they're not accepting patients from other places. Now, we're not to that point. We have typically been a hospital that tries to help and accept as many people, be a good regional network for Northwest Montana and surrounding areas. And, as long as we can do it safely and still take care of the patients in Flathead County, we're going to still provide care for whoever needs it. But the problem is, at a certain point, you reach levels where you can't keep accepting patients. And COVID always puts that in the back of our head. How much can we stretch the system? How much can we strain the system? And doctors and nurses and respiratory therapists and everybody else are at the same strain as other people. We're just exposed to it even greater because we're exposed to patients on a regular basis. I go to work every day knowing that I could come home with COVID and infect my family with COVID. And it's just a daily low-grade stress associated with the fact that I could infect my children and my wife just from what I do at work. Even if I'm being as careful as possible, there's always a chance, as infectious as this disease is, that I could catch it.
And I think that's an important point. That strain on the hospital system, is it affects not just people with COVID, but people coming into the hospital with other, illnesses that they still have to deal with the situation with reduced nursing staff and reduced beds and so forth, right?
Mm-hmm.
So even if they're not concerned about COVID, but might have other illnesses that they have to go to the hospital for, COVID could affect.
Life still goes on. People still have heart attacks. People still get infections. People still need surgeries. And if your staff is stretched thin or you don't have the beds, it makes it very difficult to provide the care that's needed for everything else. So
I want to talk a little bit about, we have infection really taking off in the valley. We have a group of people who are very skeptical about the recommendations about how to avoid infection, including the masks. There's some other, I think, rumors or myths going out there about testing and the reliability about that. Could you speak to some of these myths that are going around in the community about this issue?
Yeah, we know, people believe what they read. And a lot of these search engines, a lot of these social media sites tend to feed into whatever you want to believe. Unfortunately, a lot of this is not scientifically based. There have been multiple studies showing that there's no significant CO2 or carbon dioxide retention with mask wearing for extended periods of time. I've been wearing masks at work and around the community since March. And despite taking care of COVID patients, I have not gotten COVID. With as infectious as this disease is, without protection, without personal protective equipment, I would have already had COVID at some point. It is, people always want to look at early studies or things where the CDC may have said, well, we don't know if it's airborne or by touch or whatever. You've got to remember, this is a new virus. We have to do data. This is how science works, is by observing and then changing with whatever the observations show. We don't change the data just because it doesn't fit what we think. This is a mostly airborne illness. The things that project particles are sneezing, coughing, talking, singing, all these things. And if you're projecting droplets into the air, the only way to keep droplets from getting into the air is wear a mask. The mask is to protect you, but it's more to protect everybody else around you, to decrease the amount of COVID in the air. The other thing is that I've heard multiple times, which just infuriates me, is that COVID is not dangerous or deadly. That people are dying from other things other than COVID, like they're dying from heart attacks, and when they're getting reported as COVID, that's rubbish and that's garbage. I mean, if you want to, I wish, I don't wish that people could come, but if you could see what I've seen taking care of COVID patients, COVID is killing people. COVID is destroying people's lungs and killing them from respiratory failure, from not being able to breathe. COVID attacks and destroys lungs, and it's just very deadly in certain populations. It can be deadly in any population, but if you're over 75, if you're obese, if you have hypertension and diabetes, all these things, it is notorious for killing people in scary amounts with these illnesses. And to say that it has a 100% survival rate, or that the government is making up numbers, is just absurd. I've even read things that say I get kickbacks from overinflating COVID. I don't get kickbacks from the government. If I do, somebody's taking them from me, because I don't ever see that money. I'm just here to tell you what I see and what I'm taking care of. Doctors around the country we're exhausted from taking care of COVID, and we're exhausted from people not believing us when we say this is a dangerous disease. It's just mind-blowing that people would believe random other people who have never seen a COVID patient over people who take care of it day in and day out. You know, we've got nurses who have just sacrificed being in the COVID unit for hours on end, 12 hours a day for months, and they're exhausted and they're tired of hearing people belittle what they do by saying that this disease is not dangerous. We have respiratory therapists, we have doctors. Everybody is stretched thin and tired. And just to hear people who just don't take it seriously or who have an ulterior motive to try to appease whatever base they're trying to appease is ridiculous. This is a dangerous disease, and that's all I can say. I mean, it is fatal in a large number of people. I've had deaths over and over in the hospital from this disease, and then people will say, well, you have people die from other things. Yes, that doesn't mean I want everybody to die from anything, but people die. But you know, this is unprecedented. I've been practicing for many years, and this is not something that we've seen. We haven't seen a disease like this, an infectious disease like this before. And the thing that people want to say is, well, we'll just get our herd immunity up. It took the 1918 flu pandemic 3 years to really burn itself out. So if you want to have 3 years of just death and destruction from COVID, keep doing the same things we're doing. If you don't, practice the social distancing, wear a mask, do the things that help prevent the spread of infectious diseases. I pray that we get a vaccine. I pray that we get an effective treatment for it, because I want this to be over just as much as everybody else. I've heard that it's going to go away after the election. Well, I sure hope it does, but I have no doubt that the people in the hospital didn't get the memo that it's going to go away after the election. All of this stuff is just things that I guess just make people feel safer or feel better by belittling the disease. I don't want people to live terrified, but I would like them to have a little bit of restraint and a little bit of wanting to protect other people. It's like I said in many other talks, this is not just about you. You could be 25, you could be 40 with no medical problems, and you could do fine. This is not all about you, it's about other people. Please, please, please take care of your elderly loved ones. Take care of your people who can't fight infection, and do the right thing. I'm not just trying to tell you what to do. Montanans don't like to be told to do. I'm just begging you to please help us, help everybody else by not spreading this disease around.
Yeah, absolutely. I couldn't agree more. Thank you, Dr. Keeton, for what you're doing up at the hospital, serving these patients, and all your colleagues up there. I know it's incredibly difficult, and the strain is difficult, and I appreciate the work you do. And I hope more of members of our community do listen and act on behalf of your neighbors and your community to try to curb the infection rate here in the valley. So thank you very much for joining me, and I hope things turn around soon for all
Thanks.
our sake.
Thanks for having me. I appreciate it.